Can science make dead alive again? In the 21st century, scientists have made incredible strides in the field of medicine. With new technology and a better understanding of the human body, we are able to treat and cure diseases that were once considered fatal. But what if science could do more than just prolong life? What if we could bring people back from the dead? It may sound like the stuff of science fiction, but researchers are already working on methods to resuscitate people who have died. While the idea of resurrection may seem like something out of a horror movie, the reality is that science may soon make it a reality. In the following article, we will explore the possibility of bringing people back from the dead and the ethical implications of such a technology. It seems like a question that has been asked since the beginning of time. Can science bring back the dead? While there have been many advances in medicine and science, the answer is still a resounding no. When someone dies, their body starts to decompose immediately. The cells break down, the organs shut down, and the brain stops functioning. Once this process starts, it is irreversible. Even if science could find a way to bring back the brain and heart, the rest of the body would be so decomposed that it would not be able to sustain life. There have been some attempts to bring back the dead using science. In the early 20th century, scientists tried to use electricity to shock the heart back into life. This method was unsuccessful and often resulted in death or brain damage. More recently, scientists have tried to use cryogenics to preserve the body in the hopes that someday science will be able to bring them back to life. This process is expensive and is often not covered by insurance. There is also no guarantee that it will work. So, while science has made great strides, it has not yet found a way to bring back the dead. For now, the best we can do is to cherish the memories of our loved ones and try to live our lives in a way that would make them proud. What happened after death? Scientists have long been fascinated by the idea of resuscitating the dead. The idea of being able to bring people back to life after they have died is the stuff of science fiction and horror movies. In the real world, however, the science of resuscitation is well established and has been used for centuries to save lives. Resuscitation is the process of restoring circulation and breathing to a person who has stopped breathing and their heart has stopped beating. It is a life-saving intervention that is usually performed in an emergency situation, such as when a person has suffered a cardiac arrest. The first step in resuscitation is to assess the situation and determine whether the person is truly unresponsive and not breathing. If they are, then rescuers will begin CPR cardiopulmonary resuscitation by chest compressions and rescue breaths. If the person has a pulse but is not breathing, then they will be given rescue breaths. If they are not breathing and do not have a pulse, then chest compressions will be started. The goal of resuscitation is to restore circulation and breathing so that the person can survive. It is a complex and difficult procedure that requires a team of trained medical professionals. Once the person is resuscitated, they will be monitored closely and treated for any underlying medical conditions that may have caused the cardiac arrest. If they have suffered brain damage from the lack of oxygen, they may be placed on a ventilator to help them breathe. The long-term prognosis for someone who has been resuscitated depends on the underlying cause of the cardiac arrest and the severity of the brain damage. In some cases, people make a full recovery and are able to lead normal lives. In others, the brain damage may be so severe that the person is left in a vegetative state. Although resuscitation can be a life-saving intervention, it is not without risks. The most serious complication of resuscitation is brain damage, which can occur when the brain is without oxygen for too long. This can lead to long-term problems, such as memory loss, difficulty speaking, and muscle weakness. There is also a risk of infection when resuscitation is performed, as it involves opening the mouth and nose to give rescue breaths, as well as performing chest compressions. Despite the risks, resuscitation is an essential life-saving intervention that can bring people back from the brink of death. It is a complex and difficult procedure, but one that can make the difference between life and death. It is clear that science has the potential to bring people back to life. Whether or not this is ethical is still up for debate. Some people believe that science should be used to bring people back to life, while others believe that this is an unnatural act that should not be done. The debate is likely to continue for some. Thanks for watching. Please subscribe our channel.